Well, summertime is definitely a trend to try to get healthy. Last month, we brought you here to PDLabs to talk to you all about the Metabolic Code, which is a very cool metabolic program that unlocks the healthiest version of yourself. And today, we are back to talk to Chanel Roberts, a pharmacist here at PDLabs, and Ray Solano, clinical nutritionist, pharmacist, and owner of PDLabs, who actually took the questionnaire and the blood test. And we're here to talk about the results, and there were a few surprises.
You know, last month I introduced the Metabolic Code. That was developed by Dr. Jim Laval. That really goes through what your metabolic deficiencies are. It starts with 140 questions, and then we pair it along with a blood test that really understands where you're trending and to really understand exactly what your metabolic deficiencies are. So a combination of those two is very powerful.
So we sit and we go over the answers to your questionnaire and also your lab results if you choose to do that, and just look at trends that were uncovered by all of that information, and then recommendations for diet modifications or supplements can be made at that time. And we just talk about what your lifestyle is and how this can all fit in.
Now, I did this consultation myself to make sure that I understood the entire program. I was quite surprised by the results because I thought I was doing very well. Well, it was a transformational event. I had the report, and again, it's a 62-page report along with the consultation, and I understood that I was trending toward high blood pressure, type 2 diabetes, and cardiovascular disease. So, of course, my first comment was, I'm going to die. So it made me make some major changes in my lifestyle, foods I ate, and also the supplements I took. So I realized that I had to do something, but the first time I'd ever seen something that was so dramatic.
So the program takes your symptoms based on your questionnaire answer, so your symptoms, your lifestyle, along with the lab results, and it creates a report that looks at trends. So instead of waiting for disease to be there, we can detect before things start to happen. So we can look at trending disease. And with Ray, it was just 2 months, a 2-month window, and he lost 10 pounds, made some dietary changes, increased physical activity, and some supplements, and it just made a huge difference in just a short amount of time.
It was so many simple changes, things you never knew before. I had to reduce the amount of saturated fats I was taking. It also had to increase the exercise. And then when you realize the numbers start coming down and you start losing some weight, which you never were able to do before, you realize this is not that hard. So we want to make sure we let everybody know that this is a program that anybody can do to get started with. But you know what? It's important for people to take that first step.
We do uncover information that patients don't know. That can be presence of an autoimmune disease. It can also be trending toward diabetes, which they may not know. And these are things that don't get flagged typically at their doctor's office. So we look at the things that happen maybe before they get a call from the doctor that says you need to be on a blood pressure medication or you need to be on a diabetes medication.
We're making it really easy for everybody. They can go to our website, PDLabsRx.com, look under the Metabolic Code tab on our website, fill out the information. We'll have one of our team members contact you, give you the free questionnaire, and maybe make an appointment to go through a consultation. If you want to do the blood test for a small fee, we can do that as well. When you put these two together, you get a very powerful snapshot of where you are today and where you're going to go in the future.
The doctor doesn't tell us these things until disease is present a lot of the time. So we can track it before the disease is actually present.
PDLabs is a specialty compounding pharmacy. We have unique formulations for mold, Lyme conditions, erectile dysfunction. But it's important we personalize medications for patients. We want people to get better. We want people to feel the best they can be. So, we have a lot of health tips on our website, PDLabsRx.com. They're free. We do a podcast, Healthy Choices XM. We're really dedicated to your health. You have a choice in your health care, so we want people to take responsibility for their health.
Well, Ray does always tell us he likes to practice what he preaches, so to be able to go through those results in real time with him was pretty eye-opening. If this sounds like something that you want to take advantage of, head to PDLabsRx.com to get that questionnaire filled out for free, and we'll see you on the next Wellness Wednesday.